Hello, welcome to our latest public health conversation starter. This is a series of discussions we're having with thinkers who provide a critical perspective on the work of public health. Today, I have the privilege of speaking with Dr. Eduardo Gómez. Dr. Gómez is a political scientist with a focus on the politics of global health policy reform. He's Associate Chair of the Department of Community and Population Health and Director of the Institute of Health Policy and Politics at Lehigh University. He's a former term member of the Council of Foreign Relations. He's the author of several books, including his latest, Junkfood Politics, How Beverage and Fast Food Industries Are Reshaping Emerging Economies, being published by Johns Hopkins University Press. We wanted to talk today to Dr. Gómez about his book and about the role of commercial forces in shaping health globally. I am delighted he's here with us today. Welcome, Dr. Gómez. Welcome, Ed.
Thank you very much, Dean Galea. It's an honor to be here.
So let me jump in a little bit about your background for a second. Can you just give us a little bit about your path as to how you came to focus on global politics of health policy reform?
Absolutely. Well, when I was in graduate school at Brown University, I went there to really focus on the history of federalism in Brazil. And as I was doing research, I wrote an article in my first year in grad school on decentralization processes. And I was really interested in the politics of decentralization. And a professor at the Harvard School of Public Health contacted me and read the article that I had published in Studies of Comparative International Development, and invited me to go to the Harvard School of Public Health and do research while I was writing my dissertation at Brown. And I was really through that connection that I started to get interested in health policy. I had no interest in that topic until then. And I explored in one of my graduate seminars at Brown, I did a paper on decentralization and health in Brazil. And that really opened my eyes to the world of health policy and politics. And I soon very quickly began to realize the lack of research on a political science perspective on global health. And so I went to Harvard. I was there for a few years writing my PhD, and I would travel between there and Providence all the time, and ended up writing my dissertation on the US and Brazil's response to HIV, AIDS, and obesity, both highly contested epidemics, and how Brazil was doing innovations that the US wasn't. And then from there, just my career just went off into looking at non-communicable diseases, and more recently, the role of industries in the food sector. So that's how I got interested in the field.
Well, that leads perfectly to your new book, Junkfood Politics, which, by the way, is terrific. Lead us through how you came to write this book.
Sure. So I remember it was as like yesterday, I was at a cafe in London while I was at King's College London, and I had two things I realized. One, I had just read an article in the New York Times about how the sugar industry during the 1960s was influencing nutrition science, and effectively questioning the link between sugar consumption and heart disease, and pushing instead for the trans fats and its contribution to heart disease, and that this was shaping the science on heart disease for many years, and eventually nutrition guidelines within government. And at the same time, I was realizing that despite Brazil and Mexico's impressive prevention programs on obesity and childhood obesity, the rates of childhood obesity and type 2 diabetes among adolescents was still increasing despite all these policies. So I started to realize that there must be something else going on. If prevention policies and awareness and nutrition isn't enough, what's happening, and how are these industries that can distort science and data so much, what is their role in the process? So then I started to look into the role of industries and their work with government and civil society as a possible explanation for why we haven't seen aggressive efforts to regulate the sale and distribution of foods that are unhealthy for us. And that's really where the project came along. I have been working on Mexico and Brazil and the BRICS in my previous book on geopolitics and health. And I wanted to continue focus on the emerging economies, but I included the case of Indonesia and South Africa and sort of my research. And so that's where the origins of the book came from.
You mentioned Mexico for a second. Let's talk about Mexico, because Mexico is a really interesting example. Right, about 10 years ago, Mexico adopted national soda tax. Can you just talk a little bit about that, how it was achieved, lessons both about from Mexico itself, but also lessons about the effectiveness of such an effort?
Sure. So that was a long process of the soda tax that eventually was passed by the Congress in 2013, coming into effect in 2014. And there are several different factors that were going on at this time. One, you had activist groups, very, very influential at Poder del Consumidor, which is a very big NGO focused on nutrition and health, and they were lobbying the government for many years in the soda tax. But also you had the Enrique Peña Nieto administration that was also trying to put together a coalition for tax reform, fiscal reform. And the idea was really to see the tax as an economic issue, which would bring a lot of revenue to the government, but at the same time addressing a health issue, which the president had gone into the media talking publicly about how bad the situation was in Mexico. And so it was really a combination of these factors, the president concerned about the health, the president seeing this, and the Congress as a part of a tax fiscal package that would provide revenue. The intent also was to use the revenue to fund water fountains in schools and try to reinvest in schools by providing water. And at the same time, a very strong activist community that had the support of major funders like the Bloomberg Foundation that was advertising publicly about the importance of the soda tax and increasing knowledge about that. And so these factors really contributed to it. And I think that since the tax has been implemented, it's been very successful in limiting and reducing the consumption of sodas. And I think that in recent years, the government and the AMLO government has actually gone in public more recently in the past couple of years, talking about the harms of drinking Coca-Cola and other sugary products, which is a new thing that the government has never done before. So I think that the tax is showing success. And as you know, Mexico was the world leader to develop the first ever sugary beverage and ultra-processed food tax. And it sort of led the trend globally, arguably, for a national level tax. We had the California tax, of course, at right around the time, but that was state level, but this is a national level tax.
Let's touch on it's interesting to hear about how this evolved in Mexico and to read about it in your book, but let's talk about something else which you touch on in your book, which is the balance that needs to be achieved to actually overcome some of these junk food politics. And let's talk about the balance between information and regulation. So the balance between making an effort to tell consumers what's in the food and versus telling companies what they can put in food. Can you just reflect a bit on where you've arrived at in your minds as somebody who's sort of immersed yourself in thinking about this for the past several years?
Yes. Well, I think that it's very easy to provide information. In the book, I mean, there's no question that these governments are doing a good job of providing awareness about obesity, about the association of obesity with the consumption of these foods, about exercise in schools, many examples of where governments are talking about and sharing this information. But it's very different when it comes to regulation. And when you start to try to impose restrictions on what industries are doing in terms of where they can sell things, how they can sell things. And of course, that really gets to the heart of the challenge, is doing that extra step of trying to tell and limit what industries can do. And that's sort of been the challenge. I think that, that is, the politics involved in that and sort of the resistance and sort of what industries do often to propose self-regulation or engage in corporate social responsibility initiatives to sort of show that they are partners and working with the government to avoid everything they can to avoid those regulations. There have been successful cases in Mexico in limiting the advertising of certain products. And in some cases like Brazil, sort of resolutions and sort of agreements that certain foods should not be sold in schools. But another problem has been enforcement. And as I talk about in the book, in the case of Mexico, for example, where there's been families reported that despite the national policies on not selling sodas in schools, that is still happening. So the issue of enforcement and working with local governments to make sure they comply with federal guidelines and regulations is a major issue, and something that we're very familiar with here in the US with the federalist system. So nutrition, I've arrived at the nutrition and information is not a difficult thing. I think that is something that governments have been doing very well. But when it comes to crossing the line and really passing legislation that limits advertising and point of sales, that is a very difficult situation, because ultimately that really is infringing on where industries can sell their products.
Let me shift for a second to COVID, because I'm asking everybody who we talk to in this series about COVID a little bit as we start what I think will be a long process of thinking carefully about COVID and what we can learn from the moment. Now, the work that you do broadly is within this umbrella of the commercial determinants of health, which is a book which I just put together recently, which you contributed part to. Thank you. Can you talk a little bit about your perception of the role of commercial determinants during COVID? How did commercial forces intersect with the pandemic?
Well, I think that's a great question. I think that certainly in many different ways. One is sort of advertising and sales, and sort of increasing the using social media and sort of increasing awareness about the availability of foods that could be sent to your home while you're in quarantine. And so taking advantage of that social media presence, also using the COVID-19 as an excuse for congressional members or health officials to convene to talk about policies. I do recall reading a lot about that and how in some countries that COVID was being used as an excuse to delay the discussion of legislation for important policies. And I believe that was in the case of Mexico that happened, where that industry was using that discussion when it came to the food labeling initiative that was eventually passed in 2021. I do recall now that the industries were sort of using the COVID to sort of delay that legislation further, which the government eventually succeeded, as you know, in 2021 to adopt Chile's Black Octagon nutrition labeling. So so both on policy making, on sharing of information and targeting audiences through social media apps, and sort of taking advantage of that. I think that was sort of the context where industries were using to sort of have some kind of advantage during that process. Now, I remember, as all of us do, that during that time, I could not go to gyms, during that first 6 to 8, 10, for the year before, until the vaccine came out. And that was a time when a lot of people were benefiting from these online apps and ordering foods and seeing things online at the time.
You sit in this, to my mind, a very useful place in that you're friends and adjacent to public health, but you're not fully in public health, which I think actually can give you a perspective that is very helpful to those of us who are squarely in public health. What's your sense from where you sit about how effectively or not public health engaged with the commercial forces that shape health during the pandemic?
Oh, that's a good question. How the public health engaged with the commercial forces during the pandemic? Do you mean health officials or research scientists and experts?
All of it. I mean, yes.
All of it. Okay. Well, I think during the pandemic, I think public health health officials and scholars were sort of the leaders and really, telling us about the warnings about the harms of commercial determinants. And I think you're as an example of sort of, warning us and informing us community about the harms of the potential harms to the commercial determinants. I think that provided a very important time period for really the science to emerge and to discuss about the importance of all the different prevention efforts we were talking about in masking and social distancing and sort of questioning sort of the activities and also the products that we consume, to be very careful about that. So I think that, public health in general, of course, it was a very contentious time during the COVID scenario, but researchers were very important at the time of sort of highlighting, the do's and don'ts, and even if they went against corporate interests at the time. And so I think that, we had a really good scientific public health response in the research community at a time that was really highly contested. And I think that's something admirable. And I think that it was great as someone, as a political scientist, that's not in a traditional public health area. So I think that's what I noticed during that time.
I have two more questions for you. Number one, I always think of policy actions as choices. Now, obviously, they're difficult choices to make. They involve a lot of people, a lot of stakeholders, but they're ultimately choices that we make as a society. So what would be, from your perspective, the priority choices, policy choices that we should make in order to align corporate activity with health?
I think the choices that we should make to align corporate activity with health, in terms of what corporate is actions and sort of what they're doing and sort of our own
Yeah,
choices.
but at the policy level, at the public policy level, that can actually do that.
I think that in terms of shaping consumer choices, I think
It
that
it could be consumer choices. It could be it could be corporate manufacturing. It could be decisions that are made within the private sector about how to approach consumers. I mean, any of these are levels of corporate action, of course.
I think that one thing that needs to certainly be done is to increase the presence of activists and community members in corporate discussions about products and also within government. The choices and the decisions made in government and corporate need to be really aligned with what community members need. And so I think that there needs to be, going forward, more of a commitment on both government and industry to meet with consumers, but especially marginalized communities and sort of meet and trying to meet what they need the most. As someone that's been studying developing nations in Latin America for most of my career, it's certainly a very large disconnect between elite decision-making and society. And I think that really needs to be reduced throughout Latin America. And in the US as well, we do need that space for civil societal actors to be involved and to meet with corporations and government and to have those important conversations. And I think that is critical for making effective choices, both in the corporate end in terms of what services they can provide and what governments can do to align their policies with consumer preferences.
That's interesting. Thank you. My last question: what gives you hope? We're talking in 2023. What gives you hope?
What gives me hope is that more than ever, we are learning more as a society about what good nutrition is. And I think that, as I talk about in my book, in the chapter on Fear and Opportunity, in the West, industrialized West, where we've been exposed to unhealthy foods for a very long time, but also in other emerging economies, we're starting to see more and more activism and public awareness about the importance of food and nutrition and exercise, but what is going into our foods. And I think that this, through social media, through research, through public discussions, because of our online global presence, more and more people are learning about how to eat properly, what foods to avoid, what to do to lead healthy lifestyles. And I think that gives me hope. We do have the climate change crisis, which is my next area of research, and its effects on food security and malnutrition. And that's something that we have to be very aware of, and we're making progress in certainly doing that, and the linkages between that and malnutrition. But what gives me hope is just the greater public knowledge and the greater interest among the public in these areas of nutrition and health.
I really appreciate that answer. Thank you. Thank you for writing this book. Thank you for everything you do. Thank you for talking today. Thank you, Professor Gómez.
Oh, thank you so much, Dean Galea. It's an honor to be here. Thank you.
Take good care of it.
Thank you. You too.